Question 1. A client with dysphagia is being prepared for discharge. Which outcome indicates that the client is ready for discharge? A. The client is free from esophagitis and achalasia. B. The client reports diminished duodenal inflammation. C. The client has normal gastric structures. D. The client doesn't exhibit rectal tenesmus. Correct answer is A. The client is free from esophagitis and achalasia. Question 2. A client recovering from gastric bypass surgery accidentally removes the nasogastric tube. It is best for the nurse to A. Notify the surgeon about the tube's removal. B. Reinsert the nasogastric tube to the stomach. C. Document the discontinuation of the nasogastric tube. D. Place the nasogastric tube to the level of the esophagus. Correct answer is A. Notify the surgeon about the tube's removal. Question 3. A client has a gastrointestinal tube that enters the stomach through a surgically created opening in the abdominal wall. The nurse documents this as which of the following? A. Jejunotomy tube. B. Nasogastric tube. C. Orogastric tube. D. Gastrostomy tube. Correct answer is D. Gastrostomy tube. Question 4. Patients diagnosed with esophageal varices are at risk for hemorrhagic shock. Which of the following is a sign of potential hypovolemia? A. Hypotension. B. Bradycardia. C. Polyuria. D. Warm moist skin. Correct answer is A. Hypotension. Question 5. Which of the following is an outcome of histamine 2, H2, receptor antagonists blocking the action of histamine in the stomach? A. Blood phosphate levels are elevated. B. Symptoms of gastroesophageal reflux are relieved. C. Acid indigestion is relieved. D. Acid secretion is reduced. Correct answer is D. Acid secretion is reduced. Question 6. A client is prescribed tetracycline to treat peptic ulcer disease. Which of the following instructions would the nurse give the client? A. Take the medication with milk. B. Do not drive when taking this medication. C. Be sure to wear sunscreen while taking this medicine. D. Expect a metallic taste when taking this medicine, which is normal. Correct answer is C. Be sure to wear sunscreen while taking this medicine. Question 7. The nurse is caring for a 68-year-old patient admitted with abdominal pain, nausea, and vomiting. The patient has an abdominal mass and a bowel obstruction is suspected. The nurse auscultating the abdomen listens for which of the following types of bowel sounds that is consistent with the patient's clinical picture? A. Low-pitched and rumbling above the area of obstruction. B. High-pitched and hypoactive below the area of obstruction. C. Low-pitched and hyperactive below the area of obstruction. D. High-pitched and hyperactive above the area of obstruction. Correct answer is A. Low-pitched and rumbling above the area of obstruction. Question 8. The nurse is preparing to insert a nasogastric tube into a 68-year-old patient with an abdominal mass and suspected bowel obstruction. The patient asks the nurse why this procedure is necessary. Which of the following responses is most appropriate? A. The tube will help to drain the stomach contents and prevent further vomiting. B. The tube will push past the area that is blocked and thus help to stop the vomiting. C. The tube is just a standard procedure before many types of surgery to the abdomen. D. The tube will let us measure your stomach contents so that we can plan what type of fluid replacement would be best. Correct answer is A. The tube will help to drain the stomach contents and prevent further vomiting. Question 9. A 61-year-old patient with suspected bowel obstruction has had a nasogastric tube inserted at 4 a.m. The nurse shares in the morning report that the day shift staff should check the tube for patency at which of the following times? A. 7 a.m., 10 a.m., and 1 p.m. B. 8 a.m. and 12 p.m. C. 9 a.m. and 3 p.m. D. 9 a.m., 12 p.m., and 3 p.m. Correct answer is B. 8 a.m. and 12 p.m. Question 10. A colectomy is scheduled for a 68-year-old woman with an abdominal mass, possible bowel obstruction, and a history of rectal polyps. The nurse should plan to include which of the following prescribed measures in the preoperative preparation of this patient? A. Instruction on irrigating a colostomy. B. Administration of a cleansing enema. C. A high-fiber diet the day before surgery. D. Administration of 4 antibiotics for bowel preparation. Correct answer is B. Administration of a cleansing enema. Question 11. A home care nurse is caring for a client with complaints of epigastric discomfort who is scheduled for a barium swallow. Which statement by the client indicates an understanding of the test? A. I'll drink full liquids the day before the test. B. There is no need for special preparation before the test. C. I'll take a laxative to clear my bowels before the test. D. I'll avoid eating or drinking anything 6 to 8 hours before the test. Correct answer is D. I'll avoid eating or drinking anything 6 to 8 hours before the test. Question 12. When assisting with the plan of care for a client receiving tube feedings, which of the following would the nurse include to reduce the client's risk for aspiration? A. Administering 15 to 30 milliliters of water every 4 hours. B. Aspirating for residual contents every 4 to 8 hours. C. Keeping the client in a semi-Fowler's position at all times. D. Giving the feedings at room temperature. Correct answer is C. Keeping the client in a semi-Fowler's position at all times. Question 13. When caring for a patient who has had most of the stomach surgically removed, the nurse plans to teach the client: A. That extra iron will need to be taken to prevent anemia. B. To avoid foods with lactose to prevent diarrheal and bloating. C. That lifelong supplementation of cobalamin will be needed. D. That, because of the absence of digestive enzymes, protein malnutrition is likely. Correct answer is C. That lifelong supplementation of cobalamin will be needed. Question 14. The most common symptom of esophageal disease is: A. Nausea. B. Odynophagia. C. Vomiting. D. Dysphagia. Correct answer is D. Dysphagia. Question 15. The nurse is caring for a postoperative patient with a colostomy. The nurse is preparing to administer a dose of famotidine, Pepcid, when the patient asks why the medication was ordered since the patient does not have a history of heartburn or gastroesophageal reflux disease, GERD. Which of the following would be the most appropriate response by the nurse? A. This will prevent air from accumulating in the stomach, causing gas pains. B. This will prevent the heartburn that occurs as a side effect of general anesthesia. C. The stress of surgery is likely to cause stomach bleeding if you do not receive it. D. This will reduce the amount of HCl in the stomach until the nasogastric tube is removed, and you can eat a regular diet again. Correct answer is D. This will reduce the amount of HCl in the stomach until the nasogastric tube is removed, and you can eat a regular diet again. Question 16. A non-responsive client has a nasogastric tube to low intermittent suction due to gastrointestinal bleeding. It is most important for the nurse to A. Change the nasal tape every 2 to 3 days. B. Auscultate lung sounds every 4 hours. C. Inspect the nose daily for skin irritation. D. Apply water-based lubricant to the nares daily. Correct answer is B. Auscultate lung sounds every 4 hours. Question 17. Which of the following represents the medication classification of a proton, gastric acid, pump inhibitor? A. Famotidine, Pepsid. B. Metronidazole, Flagyl. C. Omeprazole, Prilosec. D. Sucralfate, Carafate. Correct answer is C. Omeprazole, Prilosec. Question 18. A client receives a local anesthetic to suppress the gag reflex for a diagnostic procedure of the upper GI tract. Which of the following nursing interventions is advised for this patient? A. The client should be monitored for any breathing-related disorder or discomforts. B. The client should not be given any food and fluids until the gag reflex returns. C. The client should be monitored for cramping or abdominal distension. D. The client's fluid output should be measured for at least 24 hours after the procedure. Correct answer is B. The client should not be given any food and fluids until the gag reflex returns. Question 19. Patient scheduled to undergo an abdominal ultrasonography is advised to do which of the following? A. Do not undertake any strenuous exercise for 24 hours before the test. B. Restrict eating of solid food for 6 to 8 hours before the test. C. Avoid exposure to sunlight for at least 6 to 8 hours before the test. D. Do not consume anything sweet for 24 hours before the test. Correct answer is B. Restrict eating of solid food for 6 to 8 hours before the test. Question 20. A client is admitted with a diagnosis of acute appendicitis. When assessing the abdomen, the nurse would expect to find rebound tenderness at which location? A. Left lower quadrant. B. Left upper quadrant. C. Right upper quadrant. D. Right lower quadrant. Correct answer is D. Right lower quadrant. Question 21. A client with a gastrojejunostomy is beginning to take solid food. Which finding would lead the nurse to suspect that the client is experiencing dumping syndrome? A. Slowed heartbeat. B. Hyperglycemia. C. Diarrheal. D. Dry skin. Correct answer is C. Diarrheal. Question 22. A client is scheduled for an esophagogastroduodenoscopy (EGD) to detect lesions in the gastrointestinal tract. The nurse would observe for which of the following while assessing the client during the procedure? A. Signs of perforation. B. Gag reflex. C. Client's tolerance for pain and discomfort. D. Client's ability to retain the barium. Correct answer is C. Client's tolerance for pain and discomfort. Question 23. A client is diagnosed with megaloblastic anemia caused by vitamin B12 deficiency. The physician begins the client on cyanocobalamin, Betalin 12, 100 micrograms IM. Daily. Which substance influences vitamin B12 absorption? A. Hydrochloric acid. B. Histamine. C. Liver enzyme. D. Intrinsic factor. Correct answer is D. Intrinsic factor. Question 24. The nurse is assessing a client with a bleeding gastric ulcer. When examining the client's stool, which of the following characteristics would the nurse be most likely to find? A. Green color and texture. B. Black and tarry appearance. C. Clay-like quality. D. Bright red blood in stool. Correct answer is B. Black and tarry appearance. Question 25. After teaching a group of students about the various organs of the upper gastrointestinal tract and possible disorders, the instructor determines that the teaching was successful when the students identify which of the following structures is possibly being affected. A. Large intestine. B. Ileum. C. Stomach. D. Liver. Correct answer is C. Stomach. End of gastrointestinal medsurgical exam, A. Please watch out for gastrointestinal medsurgical exam, B. On Alveoly e-learning.